Hi everyone! Thank you once again for joining me in my weekly 9 p.m. Sunday live video. I am Dr. Tan Yi Ping, consultant, obstetrician and gynaecologist. As usual, all my fans, I know you are very regular followers in my evening this weekly video that has been running for the last since March. It's already been there for the last 8 to 9 months. Yes, so today is the third lecture on the topic of Maternal Emotional Health Series. So these 3 weeks I have been focusing on purely maternal emotional health, which is mainly women who are pregnant and their emotions and how it affects their babies and their birth and themselves and also their life after birth. Okay, so today we cover a very interesting topic as well, which I call birth trauma. Alright, so we're going to talk about birth trauma today, and we want to know more about how birth trauma comes about, what is birth trauma, and how does it affect these women and their children as well. Okay, birth trauma don't just affect the lady, the mother, but also can affect the baby also, yeah. So let's get some stories. I have many birth traumas to share, really many, and they come from all forms of birth, not just natural birth, not just Caesar. Natural birth can also have birth trauma. Caesar can also have birth trauma. Many people, when they talk about trauma, they always attribute it to Caesar, because a lot of people who went through cesarean, they do share their birth trauma. They do share their birth trauma through social media and many other forms they do share, but actually in natural birth also can have birth trauma. What does it mean by birth trauma? That means something happened during the birth and traumatized the mother. And after that she feels very scared to give birth again. Or she also you may see after the birth she's a different person. It's quite often we see mothers after giving birth, they don't want to see the baby, they don't want to touch the baby, they don't want to carry the baby. This is a form of birth trauma, especially if it happens immediately after birth. Very often I see that. Immediately after birth, they are not interested to hold the baby. They don't even want to look at the baby or even hold the baby or carry the baby. After a few days later, they may be slightly better, but immediately after birth, this is something we do see on and off. So let me share some stories with you. I have one case of birth trauma whereby she had a first pregnancy. She went through the normal birth, natural birth. And then at the last stage, when she was trying to push the baby out, she pushed and pushed and pushed and pushed. And then the baby cannot come out. So last the doctor need to do vacuum. So when the doctor do vacuum, and then the vacuum also failed, the baby cannot come out through the vacuum either. So last of all, the mother ended up with a Caesar. So this case, if you just talk to her about, because she came to me sometime later, which I will tell you why she came to me. But the moment I mentioned this word, your birth, it looks quite complicated. I'm quite sure you must be quite scared of giving birth again. Immediately she broke down in my room. She cried, all her tears was coming down. So when you have this type of extreme reaction when I say things like that, it obviously means you're traumatized by the birth. This is one example of birth trauma. And actually in this case, it's normally not just the cesarean. If you really analyze her case, if you really talk to her, very often it's not just the cesarean. Because you must understand, if you went through birth, you will know. At the very last stage, when the nurses ask you to push, and if your baby come out fast, it's okay. When your baby don't come out fast, let's say your baby is not coming out and it's already 1 hour, 1.5 hours, you've been pushing and pushing and pushing, You know, a lot of time, doctors, midwives, they do a lot of things in the labor room, and they say a lot of quite nasty words at times in the name of trying to encourage you. They try to say, push faster lah, if not after baby lemas. You know, they like to use this type of words, baby will lemas if you don't push. So you are actually very stressed at that time. You want to push your baby out as much as possible. If not, afterwards my baby, something will happen and it's my fault because I cannot push the baby out. So these are the thoughts that it will surface during the birth itself. And actually, in actual fact, very often, these are the words that traumatize the mother. But because she went through the vacuum and the Caesar, superficially, she will appear like the vacuum and the Caesar traumatized her. But if you really go in depth, very often are the words that were uttered by the nurses or the doctors or the midwives that actually traumatize her. So this lady actually came to me after that because of what? I saw her for all 9 months for her first pregnancy, but she didn't deliver with me. She delivered in a government hospital. Then after that, she didn't come and see me anymore until she was pregnant again. But this time she pregnant, she had 1 miscarriage. Then she pregnant another time after another year, and again miscarriage. And then the next year she pregnant again, and again miscarriage. And that was the time, in her 3rd miscarriage, was the time I brought up this issue, and she was all in tears in my room. So you see, miscarriages can be due to birth trauma. And I have more than 1 cases like that. Birth trauma leading to repetitive miscarriages. Why? Because the moment they conceive, they have fear. Before they're pregnant, they are okay. Once pregnant, they are scared. What are they scared? They are scared of the trauma of the birth. They are scared of the birth. So when they are scared of the birth, the moment you are pregnant, everything shuts. You know, when we have fear, you know, when people are scared, their face is usually pale, right? All white, pucat. So they're all white. So when you fear, why you turn white? Because all your blood vessels shrink. All your blood vessels shrink, go into spasms, so blood cannot go through. So you turn pale white. Same thing can happen to all the blood vessels that go to your uterus and everything else. So if all your blood vessels shut to the uterus, then there will be no more oxygenation to the uterus, and as a result, the baby can die. So that's why they ended up with miscarriage. That is one of the reasons. There are more than 1 reasons that end up with miscarriage, all got to do with the stress and the chemicals that release during stress. You can even have contractions in the early pregnancies that end up with a miscarriage. So that is one example of birth trauma. There are also cases that trauma because of some very extreme experience during Caesar, like I have this case who actually felt the Caesar. She could feel the pain, you know. That's why when some of the mothers tell me, doctor, I want a Caesar, I always prep them, you know, don't always think that Caesar you cannot feel anything because you're under anesthesia, because you're under half anesthesia. Some mothers actually do feel the pain of cesarean. So in this case, she tried natural birth, first pregnancy, and then halfway she needed to go for a Caesar. And the same thing again, the doctor told her, if you don't Caesar after baby lemas. You see, it's always these words. And then, okay, she agreed for the Caesar. By all means, agree for Caesar, no issue. So she went for the Caesar. But the Caesar, somehow, she felt the pain of the Caesar. She felt the pain during the Caesar, and when she told the anesthetist, so the anesthetist gave gas and let her sleep. Again, this was in government hospital, so I got no idea whether the gas that they gave her was actually full anesthesia, or sometimes, because I know when the anesthetist thinks that the anesthesia is working, even though not 100%, but it's working quite well, but because the mother can feel the pain, so sometimes they just give some lighter anesthesia just to make her sleep off, not fully in deep sleep, but partial sleep, so that she will not, that's what they think, that she won't feel the pain, she will knock out, and they can continue with the Caesar. So when she woke up, she cried and cried and cried, because she felt everything, the whole Caesar, she felt it. So that was the first pregnancy, and then over, that's it, over. But for many years after that, she could not conceive. She could not conceive, and came back to see me. So she's again another patient who saw me for all 9 months. And then she went to give birth in a government hospital. And after that, because she couldn't conceive for many years after that, she came back to see me. With some treatment, not too difficult to get her pregnant though. And she managed to get pregnant after that with some clomid and things like that. But this time her pregnancy was fine again, no problem. I saw her all the way until a couple of months, about 7 months, because she had to go to UKM. So she went back to UKM, which is the hospital she gave birth in her first pregnancy as well. And this time when she went there, and then she saw the doctor, and the doctor say, you want to try normal, can, but just in case your passage never open, we might have to Caesar you again. Suddenly she just broke down in tears, just cry and cry. Something doesn't look right. Why you cry? I mean, everyone expect, right? If you go for natural, some more you have Caesar before, there is a chance that you may end up with another Caesar, isn't it? But she cried there and then. Then when she came back to tell me that she cried, I also felt something not right. So I told her to see my therapist. So I asked her to see my therapist, and she went. Then only I know this entire story of she feeling the pain. Feeling the pain was her traumatic experience. But the thing that hit her the most was, again, did I choose the wrong method of birth? Is it I am the one to be blamed that my baby now will lemas? The government hospital, they like to use lemas. It's not just government hospital, all doctors, midwife, nurses, they like to use this word. And actually this word, I realize again and again, I see it has quite a big impact on the mother that is giving birth. They tend to blame themselves. Although the doctor's intention is to explain to them that I need to do something. If not, baby could be in danger. But the mother's interpretation is, I must have done something wrong. That's why my baby in danger. So that impact on the mother is the biggest impact. So when the doctor told her the same thing again, then actual thing that make her cry and break down at that time is because she again have these doubts that now I want to choose normal. Is it wrong again? Is it a wrong decision again? So that is the main thing that struck her, that caused her to have a traumatic birth the last round. Although in superficial wise, we will all presume that her trauma is the pain she felt during Caesar. Logic, right? The pain she felt during Caesar. But it's actually started off because of the emotions she went through, the guilt that she had before she had the Caesar. Because when you talk to all psychologists, therapists, and also psychiatrists, they will always tell you the root of all emotional issues is love. There must be love to be traumatized. So the pain cannot be the reason you are traumatized. There must be some love involved. So her love is the love for the children. Every mother loves the baby that she's carrying. The love for the children is the root cause of the problem, plus the traumatic event that triggered it. So now you generally understand how birth trauma comes. Birth trauma need to come right from the beginning. Number one, there must be some emotional disturbance in the pregnant woman first. Then there must be a trigger event. Trigger event is like a seizure, unexpected seizure, unexpected vacuum, unexpected pain during seizure. This is the unexpected event. Then this is our cases with seizure. But seizures are not the only one which end up with birth trauma. You can also have birth trauma through natural birth. This is another lady I know. She saw me for all 9 months again. And what happened is she also gave birth in a government hospital. Birth was fine. She had natural birth. But after the baby was born, the placenta could not come out. So when the placenta don't come out, what typically we do is we do a manual removal of placenta. How do we do a manual removal of placenta? Basically, we put our whole hand into the uterus. So now I put my whole hand into uterus and I scrape the placenta out. Trust me, it is a very painful event. Very painful event. So what do we do when we do this? Sad to say we are still very third world country type. If you are in a first world country like developed countries, we will definitely push the lady to the operating room, ask the anesthetist to come, put her to deep sleep, full anesthesia before we do that. That is what we are supposed to do. But in third world country, no. In the labor room, we will just give her, the normal gas that we give for people in labor, which is not at all effective, or some mild injections that make you sleep off, which is not really 100% pain relief. And then we will put our hand in and just scrape it out. Trust me, they are always in pain. Every time we do that, you do hear the mother screaming. The mother screams. She's in pain. Government hospital do it in the labor room, maybe because operating room is always packed and this is a 1 minute, 2 minute procedure, we just get it done with. Private hospital do in the labor room because of the cost involved by calling the whole anesthetist and the operating room nurses to come for a procedure that only costs 2 minutes. Will cost the mother another couple of thousand just to do that. So a lot of time is cost saving. And as a result, sad to say, it is a very traumatic event. A traumatic event. So this lady after birth totally refused to see the baby. Refused to see the baby, refused to carry the baby the whole 1 month. The husband feels something very funny. She refused to breastfeed baby, refused to carry the baby, refused to do anything. Husband brought her to my clinic. We sent her to my therapist. And then we found out after that she actually have a traumatic childhood. Abusive mother. Her problem is an abusive mother that have physically abused her all her life. So she's actually have some emotional problem even before she give birth. She all along had some anxiety disorder, but not too bad, but she has a bit of anxiety disorder that she can still cope. She still looks very normal as far as you and I is concerned. If we don't ask more detail, we won't know she has anxiety disorder. She look normal, she can go to work, she earn a living. But this trigger event just tip her off to become a different person. These are examples of birth traumas, but there are many birth traumas. But research is already well in place. There's so many research on birth traumas. And I read in that during the time when I wrote my book. For those of you who do not know about my book, you can always buy my book if you have not read. When I wrote my book, I actually went into a lot of research work on birth trauma, because many women who go through Caesar, they will claim that they have birth trauma. So what is this birth trauma about? So to have birth trauma, there must be one underlying problem. There must be one underlying problem. There must be some form of emotional instability before the birth. So either during pregnancy or just shortly before the baby is born, like those cases I mentioned about what the doctors say, what the midwives say. So shortly before the birth or throughout the entire pregnancy, you must have some emotional disturbance. So it can be a very emotional mother, very worryful mother. You know, there are mothers who fear everything. I have mothers who come to me with like 20 questions every visit, everything about, is this okay for my baby? Is it okay for my baby? Will this affect my baby? Will that affect my baby? You know, they already have so much insecurity as to whether it will affect their baby. So some amount of emotional instability. Some mothers have multiple bad histories, like multiple miscarriages before, difficult to conceive. These people are also many of them very emotionally unstable during pregnancy because there are a lot of fear. Some mothers, they have bad outcomes, maybe got one baby die, one premature birth. You know, they have some bad outcomes before this and make them also very emotionally unstable throughout the entire pregnancy. Or as the first two cases that I quote to you just now, whereby something happened during the childbirth itself, before the birth, during labor room, during birth. You know, somebody says something that made her worried, made her guilty, made her scared. Sometimes these are the words that are uttered by doctors and midwives without knowing the impact on the mothers. Doctors and midwives have good intention because they just need to let you know that your baby may have some problem, we need to do the nesting. But never knew that a lot of mothers, when we say that word, actually blame themselves, that they thought they are the one at fault for whatever that is happening, but actually it's not. No one is trying to blame her. So this underlying emotional instability must have first. Second is there must be a trigger event. You must have a trigger event. What are trigger events that we have seen? Like we said just now, vacuum delivery, forceps delivery, cesarean, placenta not coming out, bad tears. I have also one lady who have a very bad tear in one of her pregnancies. Not the first pregnancy, I think it's the second or third pregnancy. She had a very bad tear, and after that, all miscarriages. Every time she pregnant, also miscarriage. Very bad tears are also trigger events. Sometimes it may not be exactly related to the birth at that time, but things that happen to the baby after that, like baby admit ICU, baby, some mothers even like baby jaundice, maybe a bit extreme jaundice. All these are trigger events that can cause the mother to be traumatized. So first, you must have underlying emotional issues, instability. Second, there will be a traumatic event. And third, lastly, it's the support after birth. What happens to the support after birth? Did anyone in any way manage to handle that issue? So let's say nobody managed to support her. She cried to you because she felt the pain over the surgery. You hug her, you pat on her, but we still cannot relieve her suffering. It doesn't solve, because not just the pain, but also her guilt of thinking that she is the cause of all the problem. Did someone manage to support her? Which is very important. And very often this support may not be there in our day-to-day life, in our confinement style. Some of us, we have mothers, we have husbands, people like to just say this word, "Your baby safe, mother safe, enough already." People always like to say, "Thank goodness baby okay already. Thank goodness mommy okay, you are safe, I'm safe, your baby is safe." That is the most important. And these words actually does not in any way relieve her suffering. So sometimes these are the things. So we know you need three things. You need an unstable relationship, unstable emotion before that, followed by a trigger event, and then followed by the support, lack of support after birth. And that is why these people end up with birth trauma. So what are the effects of birth trauma to a woman? Number one, we know the high chance of, as I say, recurrent miscarriages or difficult to conceive because they have fear of getting pregnant and giving birth again. Also can lead to postnatal depression and the effect on the baby, because many mothers who have birth trauma, they actually don't want to hold the baby, don't want to carry the baby, don't want to nurse the baby, and it's like don't want to love the baby for a short period of time. If that short period of time is not too long, maybe not too much effect on the baby, but there will be still some effect on the baby. Because that is why we say mothers give birth to a baby, immediate skin to skin is very important for the baby. Immediate skin to skin to give the baby the first security of all in life. But if this mother doesn't want the baby, just doesn't want to hold the baby, it does have a certain impact on the baby. And long term, depending on how long it goes on. Like earlier I told you, this lady, 1 whole month also she won't carry her baby. It's not good for the baby's emotional and mental development as well. So that is why it is very important we try to avoid birth trauma. How to avoid birth trauma? First of all, identify women who are already emotionally unstable. Women with bad or multiple bad histories, or women with previous bad outcome. Women who are already, you can see in pregnancy, very fearful, very sad all the time, very emotional, always angry, always sad, always depressed, always very fearful. All these are things you can identify. Because these are people who are emotionally not so stable. And when not so stable, we already identify. What should we do? Do we just identify and just, okay, I know you are unstable, that's fine? No. Bring them to the therapist. Make them stable back. Get them stable. Why? Because I cannot control your birth. It's like almost impossible to say that make sure you definitely have a smooth and natural birth. 20% of women in Malaysia are going to end up with Caesar. And when a cesarean comes, more than half of the time, somebody is going to tell you that baby's heartbeat is no good, baby is going to be, life is at risk, I need to Caesar you. That is bound going to happen. 20% of the time. Even if you have natural birth, I cannot control that the placenta cannot come out. If you have a cesarean, we cannot 100% make sure that the anesthesia works, because we know it doesn't work 100% of the time. Even if you have a natural birth, I cannot guarantee you won't have a vacuum or forceps. And we cannot even prevent a bad tear at times. And uncontrollable. These type of things are going to happen to anyone. We cannot prevent the trigger events. But what we can prevent is make sure mother is stable to go for the birth. Because last time I also had one. Her first baby actually had a bit of abnormality in the brain, so we had to abort the baby like 6-7 months, quite big already. So that is her first traumatic event for her. And then her second pregnancy was okay only, slightly premature. Baby was in ICU for like 2-3 days. Otherwise, she's fine. But still, there are some not so good outcome. Third pregnancy, you can see she's so fearful. So fearful. She saw so many different doctors all the time. I felt something is not right with her, because first pregnancy she wasn't like that. Second pregnancy she wasn't like that. Something is not quite right with her. And I've got a feeling already she's going to end up with a premature birth. Even more premature this time. She already shows signs that she may give birth at 7-8 months. And her placenta is way down. She's going to have a cesarean. Something is not quite right in her as well. I told her to see my therapist. And luckily, she listened to me. Not all my mothers go and see therapists when I ask them to see, you know. But luckily, she see my therapist. And we made her emotionally stable. Managed to help her all to get through all her previous traumatic births and traumatic pregnancies. And true enough, 7.5 months, she had a cesarean, baby born in ICU and hospitalized for 1 month. After the baby was born, when she finished her confinement, she actually came and see me. She thanked me. She thanked me. Because she said, if I had not asked her to see my therapist, she don't know how she could cope with her baby in ICU. So because she had all her bad experiences before, one baby died, one more also premature in ICU for 1-2 days. This one some more so small, not necessarily can survive. But she coped. She said she was very stable, and this time, in fact, she coped better than the last 2 pregnancies. So you see, sometimes very important is you need to make sure that she is stable first. And in order to do so, when you identify women who are emotionally unstable throughout pregnancy, it's very important to send them to see therapists who deal with these type of cases. And that's what my clinic does. And if you look through all my previous videos in my YouTube channel, if you don't know my YouTube channel, you just go to this link below. I have 2 videos before this on maternal emotional health. If you look through, it's all the same thing. Mothers are already emotionally unstable. That's why I say these 3 videos, if you find any pregnant women near you, close to you, your relative, your working colleagues, share this video to them. Let them know the importance of being emotionally stable. Because a lot of things in birth we cannot control. And that can end up with a lot of other outcomes after that. Many other outcomes. Including people who, even if they have a smooth pregnancy, these are the women, you know, that's why I study in depth in birth trauma when I wrote my book for cesarean birth, how to prevent a cesarean birth. So, and you will realize that, because then only I start to understand why a lot of women, after one Caesar, the second pregnancy, they die one natural birth. They will go from one doctor to another doctor to another doctor to another doctor until they find a doctor that say, yes, I can let you have a natural birth. Actually, these women, you go and send them to see my therapist. I have a tendency of sending a lot of these women to see my therapist. You will see they all have some amount of birth trauma, may not be so extreme, but they also have. They also have. And so that is why they will die, must have natural birth the next time. Actually, they have some amount of birth trauma. That is why they go through all the lengths. I don't know whether you sometimes read in newspaper or social media, mother 1 time Caesar, 2 time Caesar, give birth at home and die, baby die, mother die. And you wonder, why why so much time Caesar still there to give birth at home? This lady, she must be silly, right? Or why would be she so stupid go and do things like that? She's not stupid. She has so much trauma. If you actually send her to see a therapist, she's really traumatized by the births before that. She cannot go through another cesarean anymore. Or she cannot go through going to the labor ward and being scolded or screamed at by midwives and doctors. No way. They're so traumatized already. So actually, they have a very good reason for why they choose to give birth at home. I am sure many of them went to many doctors trying to find doctors who are willing to support them. But unfortunately, these doctors are hard to find. So that is why sometimes they have no choice but to give birth at home. And you see, very often the husband support them, support the wife to give birth at home. It's because the husband understands everything the wife went through. But the doctors do not know what happened, because no one actually asked her to see the therapist to sort it out. That's why the right thing to do is to see the therapist to sort it out. Then these women are more at peace with whatever decision they make, rather than make extreme decisions by giving birth at home and risking everybody's life, including herself. But unfortunately, we do not have this service. Seeing therapists is not a norm among Malaysians. That's why every 10 person I ask to see my therapist, maybe 4 or 5 will go. The other 5 or 6 won't go. They will say, I'm okay, I can cope. And we all know, we as health professionals all know they are not okay and they cannot cope. They can never cope because they are not mental health professionals. When you are not in this profession, or your husband is not in this profession, there's no way your husband will know how to talk to you correctly to be able to convince you, or to be able to relieve all your suffering. No way. He's not professional. He's just like anyone else. So it doesn't work. Okay, so I notice many of you are just listening. I don't see questions coming in. Maybe because not many of you know what else to ask. Okay, for some of you who is the first time, who missed my last 2 videos, you can go to the link in my post. That is my YouTube channel. Go to my YouTube channel, Dr. Tan City Clinic. Then you will get to see the last videos and many videos before this. And if you have any friends, any relatives who have, you notice, very emotionally unstable during pregnancy, please share this video with them, and also share the videos to their husbands as well. Women tend to deny. And they always say they're okay. But they don't realize that whatever is happening to them have impact on themselves, their baby, as well as their husband and everyone else around them. Okay, so one of the little things that we could do in preventing birth trauma is at least try to prevent a cesarean. Because as I say, many people when they go through cesarean, they are traumatized. So to prevent Caesar, as usual, the best thing I always say is you need to have knowledge, the right knowledge to help you go through your birth to prevent a Caesar. I will be having a VBAC seminar soon. VBAC seminar is mainly trying to teach women how to prevent a Caesar. All the knowledge that is needed by them to prevent a Caesar. So if you want, please sign up for the VBAC seminar that will be running, I think, in a week's time. So go through my Facebook and you will see the link, and please register. Okay? Aisha Lucy also have a traumatic labor experience. Yes, I have also seen mothers who are traumatized just by the labor pain only. Labor pain sometimes everyone have to go through. I can't you choose to deliver normally, you have to go through labor pain. But why are they so traumatized by the labor pain alone? Very often it is still, you must know, these people have certain emotional unstable before that. That's why they cannot face the labor pain. Vivian asks, do you have to go through a cesarean if your age is 30 years and above? No, there's no age for Caesar. No such thing. Okay? Everyone deserves the chance to try, especially nowadays. Long ago, yes. Long ago, 35 and above, if it's first pregnancy 35 and above, then we used to do Caesar. We used to have a blanket rule, but nowadays nobody do that because 35 and above first pregnancy, so many nowadays, so many. Those days is a rare event, you know. It's like maybe less than 1%, so we rarely need to do Caesar for them. But now it's so common, so we usually allow everybody to try. Okay, so I guess that's all since there's no question. Next week onwards, I will be doing another series again. I think I'll be having a couple of these type of series type because there was a request by one of you to talk on menopause. So next week, I'm going to talk something on menopause. And menopause, I think everyone should know, should listen, because it is a topic that involves everyone. You will have to face it eventually, either now or later. Okay? So next week onwards, there will be a series of lectures all dealing with menopause. So that's all for now. If you have not subscribed to my YouTube channel, please subscribe. If you want to go through all my previous videos, just click on to the link and go to my YouTube channel and go through all the videos. There are actually many videos already in there. So that's all for now. Thank you and bye-bye.